Hello, I'm Dr. Barbara McKinney, and I'm happy to share with you a little bit today about patient safety. I'd like to begin by starting with looking back. How has the patient safety movement developed in the United States? Then I'd like to share the situation in the hospital where I work, and I'd like to share with you what has been done to try to improve the culture of safety in this hospital. Back in the day, everyone seemed to pretty much think that your doctors, your nurses were going to do their very best for you, and your care was going to be safe. And if you didn't like it, well, you could always sue them. But in 1999, this landmark report came out called To Err Is Human. It was issued by the Institute of Medicine, and it said that between 44 and 98,000 medical errors occurred per year. Not only did this have a high financial cost, but it also caused a loss of trust in the healthcare system. And from that point on, things have changed in the healthcare system. Several high-profile cases also captured the attention of the public and the medical profession as to the fact that we could do better with patient safety. This is a particular case of Josie King. She was a toddler. She was involved in a burn accident, and she went to Hopkins and developed a hospital-acquired infection and ultimately died. As you can imagine, her parents were very bitter, and Dr. Pronovost, one of the pioneers in patient safety, went to talk with the mother and say, what can we do to make healthcare better? It prompted the book you see here about safe patients, smart hospitals, and it has led to many, many changes in our culture of safety. I'd like to now transition to the hospital where I work. In this hospital, it is also, like Hopkins was, a very highly ranked, well-known medical center. And it was ranked very highly in the Consumer Safety Reports in 2013. The #1 safest teaching hospital in Florida and the #2 safest teaching hospital in the U.S. But the lead to this story says it all. Safety still lags in U.S. hospitals. There were a couple of things in this hospital that also encouraged the patient safety movement. #1, even in the current situation, many employees still felt like they weren't able to speak up if they saw something that was unsafe. There was a Sentinel event involving drug diversion, which garnered national attention. And as the lead says here, safety is still lagging despite all of our efforts. So the hospital where I worked decided to institute an improvement initiative focused on safety. It's called Our Commitment to Safety. I'd like to share with you that this was launched for one simple reason, and that was to eliminate preventable harm. Could we eliminate preventable harm and focus all our efforts? And this initiative comes from the highest levels of leadership and focuses on this commitment to safety. A key message that I would like to share with you, and this has been garnered from all the work that has been done up to this time on patient safety. We've looked at other high reliability organizations like the airline industry, the nuclear power regulatory industry, and we have come up with things that work, and we want to encourage them in our institution. And things that work are teamwork. Teamwork is a key to providing quality in our outcomes, our safety, and our service. So the better the team works, the better the outcomes and safety and service of our patients. This Commitment to Safety program has 3 key components, and these are tied to the deliverables that we ask the teams to produce as they go through this program. First, we ask them to develop a culture of safety, to implement specific team behaviors, and to implement a learning system. The culture of safety is an environment that we create that says we are safe here. And in creating that environment, we look to a fair and just culture. When errors occur or they don't occur, we can call that a near miss. We catch something before it occurs, or an other event, any kind of event that we don't want to happen. We view it through a fair and just culture. We ask, was it the system? And many, many times it was the system. Say there's a medical error and the wrong drug is given, but the 2 drugs are sitting very close together, or they come in similar containers. These are issues that are related to the system, and we want to focus on the system. We don't want to have a shame and blame culture on the person. We want to focus on how to improve the system. Now, sometimes it is the person. Sometimes the person knows the correct procedure and they may try to make a shortcut or do something. So that has to be dealt with in a little bit of a different way. But by establishing this fair and just culture, people know what to expect when any kind of event occurs. And then it's very, very important to develop this culture of psychological safety, where people are free to speak up. They're free to, as in the industrial term, stop the line if they feel something unsafe is happening. They're free to question. We've even developed terminology that they can use around this program. I need a little clarity here if something is not quite seeming right to them. They're free to give and receive feedback, and we've found that effective teams are very rich in feedback. Willing to give feedback when we notice positive or negative things, and willing to accept feedback, and that requires a high level of vulnerability to be able to accept positive and negative feedback. And free to innovate. People are free to try new ideas to make the system work better. Second, we have asked people to put into place very specific team behaviors. These team behaviors focus on planning forward, knowing what the plan is for the day, reflecting back after we've completed our shift or our procedure, and structured communication and handoffs. When we hand off patients, and that occurs frequently between shifts, between units, different coverage between doctors and nurses, many, many handoffs, can we develop a structured way to communicate the patient's situation to the next caregiver or the next unit? Let's focus a bit more on planning forward. Now, this is perfectly obvious to everyone that in football you need to have a huddle. You need to get together so everybody on the team knows which way to run, knows how to catch, who's going to catch the ball. But it doesn't always seem so obvious in healthcare. But if I'm the patient and I'm having surgery, I would pretty much want everyone on my team to be organized and coordinated. I would want all of the surgical techs, the nurses, the physicians, the different teams, the laboratory people to understand what and when things are going to happen. I'd want an opportunity for everyone to ask questions. Share critical information. When is going to be a crucial time in the surgery? When we'll be needing certain equipment? And there are several ways that we can work on this planning forward. We can do huddles, and we encourage all of our units in the hospital to do huddles. This is a time to bring everyone together, to share lessons learned. Maybe we learned something yesterday that we need to spread quickly to the team. To celebrate successes, to focus on things that are important to our day or our unit. Staff meetings, also important to get everyone planning forward, working on the same game plan. And then briefings. Briefings happen in our surgical and procedural areas, and these specifically focus on what is going to happen in that procedure. I'd like to take the time to stop now and share with you an actual briefing from the University of North Carolina that occurs in a surgical suite.
All right, let's start with introductions. I'm Matt Ewing, I'm the nurse surgery attending.
Tim Mariana, nurse surgery resident.
Courtney Whitesboro. Diana circulated.
Mary anesthesia resident.
Mary Payne, anesthesia.
Sean Brooks, anesthesia tech.
Lori Lett, also further stuff.
Okay, so let's talk our way through the case for a minute and solve these issues. So this will be our brief. The first thing let's talk about the surgical parts of the procedure. We have a fluid collection on our head from a previous surgery, and our plan is to open that up, find the leak, and plug it. We expect that to be relatively straightforward. We will need to remove the bone flap so that we have instrumentation to remove the screws from the previous system.
Yes, we do.
Okay. And then we'll do a repair. We may need some Durarepair. We may need some Kiss Seal. We won't open those, but have those available in the room. And then we'll replace the bone flap and close her back up. In terms of the antibiotics, I don't suspect an infection, so I think we'll start with antibiotics at the beginning. And I think we will place a lumbar drain here as the first step, so we'll get how much ancestry she received based on weight.
She's 60 kilos approximately.
So
Longer after 4 hours, that longer after 4 days.
Yeah, so we'll follow that from your recommendation. 1 gram just prior to the lumbar drain, and then we'll give it a 2nd gram right before we extend it. Okay, do you have concerns from the anesthesia standpoint, Doctor? Okay. And Courtney, any instrumentation or other equipment that you have questions about?
We have everything.
Okay. Nursing standpoint?
She has a techno screen. Are you okay with just the screen, or do you want it crossed for 2 minutes?
No, we don't anticipate high blood loss from the case, and I think just the type of screen should be fine. We won't use steroids, we won't use mannitol, we will use antibiotics. She does not need additional antibiotics. She's on antibiotics. Okay? Any questions?
We'll stop there.
Yeah, post-op, she should be able to go to a regular floor visit. And during the case, if anybody has concerns, I encourage you to speak up.
So there was an example of a surgical briefing, and let's move on to debriefing. When we debrief, we want to follow up after the procedure to see what worked well. And if something worked well, we'd certainly like to standardize it. We ask ourselves, what could we do better? And if there are things we could do better, we want to improve them. And then lastly, we ask ourselves, what could we do differently tomorrow? And we'd like to do some rapid cycles of change. And then we focus on specific, concrete 5 safe behaviors. Paying attention to detail, communicating clearly, handing off, supporting each other, having each other's back as part of a team, and having a questioning and receptive attitude, part of that willingness to give and receive feedback. And then our third component is the learning system. To create that learning organization where we learn from positive things as well as negative things, so we're not repeating the same mistakes. We can use the improvement techniques as part of this learning system, and we want to focus on data. And this learning system is actually created on a large whiteboard, so it's transparent. Everyone can see what the team is working on and learn from what we're doing. Here's an example of one of the boards. You see that we have specific aims here. We have our PDCA cycles, and we have data up here to remind us of the things that we're working on and make that learning transparent to everyone in the unit. The learning system utilizes one of the improvement tools, the PDSA cycle. And we ask ourselves, what are we trying to accomplish? We create an aim statement. We want to know that if we make a change, is it actually an improvement? So we develop a measure, a metric, something that we can monitor. And then we'll select the change. There may be many changes, but we want the one that will give us the biggest bang for our buck, the highest priority. And then we do small tests of change. One nurse, one unit, one day, one form, one shift, one physician, just small tests of change. And if those work well, we'll implement the things and then tweak the things that need fixing. So as we close, I want to say, as that old cigarette ad from the 70s, we've come a long way. We have really come a long way in our journey toward safe care for patients. But as the Consumer Reports points out, there is still a long way to go. And this has been one of the initiatives that has shown positive results as people have tried to create a safe, quality care experience for our patients. Thank you.